Hey, DNA. Kate Wilson here with another episode of All Access DNA. Why is podcasting about genetic health so important? Why do listeners need to know about genomic medicine, what's available, and how to get it? I talked to fellow podcaster Rome Madison from the Genetics for Healthcare, a podcast for patients, about his passion for patient access. We talk about gaps in healthcare, the need for patients to advocate for themselves, and innovations in genomic medicine. Let's get started. Rome, thank you so much for being on the podcast today. I'm so excited to have you.
Hey, it's an honor and a privilege, Kate. Thank you so much.
So you host the Genetics for Healthcare, a podcast for patients. And I was wondering if you could tell us a bit more about what inspired the podcast and how it differs from your previous podcast, Precision Medicine.
Thank you. Well, Genetics for Healthcare is a podcast for patients, very intentionally titled because, kind of taking a step back, my first podcast called the Precision Medicine Podcast launched in 2018. And, much like yourself, we're kind of forerunners in this medium of getting this information out there. And our goal with that first podcast was to talk about the challenges associated with the scale and access to precision medicine. Patient access to precision medicine. And we got into a number of great topics. I encourage everybody listening, hey, don't leave this one, but go, earmark that one, follow the Precision Medicine Podcast. I did 56 episodes over 5 years there. But what ended up happening was the audience that grew were industry folks, people that were already in the know, people who were entering into the space on the industry side and wanted to kind of find out what are the latest, innovations, what's new, what's happening, and had a wonderful time doing that. But what happened is the insider audience grew, but the patients, the people who we were really doing this for, to educate clinicians and industry folks to articulate the value better so patients can get access, the patient audience, it seemed to be a gap. So my approach in this podcast, Genetics for Healthcare, is really reaching patients in a very, decidedly non-medical, environment. We talk about a lot of, heady, academic stuff, but my guest explains it in a way that's very simple for someone who is not in medicine or healthcare to understand. And that's very intentional because our mission with this podcast, Genetics for Healthcare, a podcast for patients, is to speak directly to patients and their family members by sharing patient stories of what they went through, what they learned, what they did not know going into the process. And those patients will share firsthand, knowledge and then give practical tips to someone else. If you find yourself in that situation, here's some questions you can ask. Here's some things that you can do to be better prepared. And we learn from patients, but we also interview experts in the field like yourself who talk to us about why this genetic and genomic information is relevant for our healthcare. And it's not just in the condition of treatment, but it's for screening. It is for knowing our risk. It is for tracking our hereditary, passed down conditions, and even clinical trials and survivorship after you've been cured of disease. So that's our goal and our mission, is to kind of provide that bottom-up pressure in the market so patients can be armed with information, the language, and the confidence needed to have these conversations with their care providers and their family members to ensure that they can get access to this information when it's important.
I love that. And that's one of the goals that I have with the All Access DNA, is to let patients know what's available, what they can ask for, what will impact their health. Because I think it used to be that, like you said, it was a lot of folks in the industry, the healthcare providers, and learning more about genetics, but it's really out for mainstream medicine at this point. And patients need to know what it is and what to ask for.
Absolutely.
Yeah. And so I was looking in your LinkedIn profile because I honestly was surprised we hadn't met before, because we've crossed a few paths in Texas and on the industry.
Right.
Having been in those areas. But so you had, a career in sales starting in that way. How did you transition from doing things on the sales commercial side to getting into podcasting and education and trying to reach patients directly?
Well, there's a lot there. So I actually started working for the first company that ever had any type of molecular assay that identified patients who were most or least likely to respond to therapy, cancer patients, most likely to respond to therapy. And that was in the early 2000s. I started in the industry the same year that the Human Genome Project completed. And I wanted to just take a minute to speak to people who are, I don't apologize about my faith, but, I'm a believer. I'm a believer that, things that happen in our lives happen for a reason to move us to a place of purpose. They serve us in some way. And so prior to me working for that company, I was unemployed for nearly a year. If you look up, my credentials on LinkedIn or my website, romemadison.com, I don't really have the typical credentials needed to work in this field. I am not an MD, not a PhD. I'm not a genetic counselor. The year before I started working for that company, I was unemployed and for nearly a year. And when I started working and I got the opportunity to interview with this company, I had to go to Barnes and Nobles. I had to go to Borders Books. If you remember that we used to have bookstores where we went and bought books and bought a cup of coffee. Now we got coffee shops where we buy coffee and bring our books. But the reason I did that, Kate, is because I had to study. And this was a new technology. This was a new company, the first of its kind. And, the recruiter just believed in me. He believed, he's like, I know you're a self-starter. You could probably do it. You don't have the requisite, background, but I'm going to put you up for this. And so I prepared myself. I went to these bookstores so I could get the books off the shelf and then copy, take notes. And then I would put the books back on the shelf because I didn't have the money to actually buy the books. The one thing I did get was a Mosby's Medical Dictionary so I can understand the terms. And so I was a self-taught, learner in this space of, genetics and genomics. And I obviously ended up getting the job. But from that time, the industry grew. The clinical use cases grew. More data grew. More studies were published. And I just learned the application of clinical genomics by disease state, lung, breast, ovarian, liver, pancreas, on and on and on. And so I had the privilege over that time of hiring, training, and developing, salespeople. I'm very proud of the fact that well over 20 people that I've brought in and trained in this industry are now, first line leaders and above, some vice presidents, some running divisions. But I will tell you, what has kept me going through this is 2 years after I got in this space. And, we think it's hard now to get doctors to order this for patients and try this. It was really bad back then. Like, I had a doctor tell me I was selling snake oil. Okay. Biomarkers. What are you talking about?
Yeah.
But 2 years into this, building my business, going and being an evangelist for, precision medicine, biomarkers, genomic information. My father was diagnosed with colorectal cancer, and the hospital system and the surgeon that performed his surgery and where he got his care, they were clients of mine. So I had worked with this colorectal surgeon, making sure that, we needed fresh tissue for the assay that we were running. Over 10 years when I first started in the industry, I have over 20,000 hours in the operating room, like watching tumors be resected from patients. And when the surgeon made the connection that this was actually my father, he called me on the cell phone the day before and was like, well, Rome, don't you want to come to the surgery? I was like, of course I do. I mean, I didn't know that I could.
Was your dad okay with that?
My family, they knew this is the work that I did, right? So I was in the operating room every other day somewhere with somebody's father, mother, brother, sister, cousin, daughter, you name it. So this was just normal for me. I was certainly, that strength and comfort for my family when my father was diagnosed, letting them know it'll be okay. But I was able to stand bedside with the surgeon as they resected my father's colon cancer and went through his large intestines and his abdomen looking for, metastatic implants. And they did the ultrasound in his liver looking for any type of implants. And they found the tumor. He was able to show it to me and resect it. I followed the tumor like I would down to pathology to make sure that, that they were going to accession and handle that tissue the right way. I'm proud to say that today my father is a 20-year colorectal cancer survivor.
Wow.
But this is what got me into podcasting. Kate, I think, what if I would have gotten discouraged?
Right.
What if along the way, when I'm going to Barnes and Nobles to write this stuff, I said, there's a whole lot of other jobs I can do, than just to interview for this. This is crazy. And so that is what has been the fuel in my tank all of these years is there is somebody's mother, there's somebody's dad who their doctor doesn't know about this. They don't have someone in their family who is an insider in the healthcare community or the healthcare system to know about these advanced technologies. And so what really got me into podcasting is recognizing that gap that we just talked about is that the more innovation happens, it doesn't mean a thing if patients can't have access to it. And so, with my experience and of really talking about very complex things and try to make them as simple as possible, I thought this would be the best medium to reach patients, to give them this knowledge, this language, this confidence that they can have these conversations with their clinicians, their healthcare providers, and their family as well.
Yeah. Yeah. And I think you call it something good. It's something I used to say, like in product, it doesn't matter how awesome a test is. If nobody uses it, it doesn't matter. Does not matter. And so I think it's important with your Genetics for Healthcare podcast is trying to fill that gap. I would also say you're the perfect host for it because you're somebody that didn't have that background and you had to teach yourself and learn on the job and figure it out. So you have more of a perspective that's very similar to other patients, right, that don't have the background, that are trying to figure out what do we do with all this information right now.
I appreciate that.
One of the things I wanted to talk to you about, just because you've been on the business side, the industry side, is that working in healthcare, in the business of healthcare, you're having to deal with like sensitive data, so especially genomic data, right, from patients. You're also thinking about patient care, like you said, it's somebody's mother, somebody's brother. It's, there's a family network. But you're also working in a business in terms of growing revenue, right? Being able to earn money to keep the business going. How do you think companies can balance their commercial goals with the ethical responsibility in terms of healthcare?
Well, different ways to look at that. They're kind of one and the same because for companies who are not taking those precautions in compliance in their processes and systems, they won't have customers because you have to instill trust in your customer base or you lose that. But another perspective is for those who are uncomfortable with saying, well, I don't want anybody testing my genetics and genomics. I don't know what they're going to do with it. I recently interviewed Dr. Michael Snyder, who runs the Snyder Lab at Stanford University. And the way he put it is for those who are uncomfortable about sharing their genetic information because it's going to get out, get over it because there's so much information about you that's already out there. And, if it's online, it is not public. But in a real sense, the healthcare systems, the insurance companies, they're already using, patients' data. They're de-identifying it. They're selling it for market research, for other use cases. And so I think the way to balance the responsibility of achieving commercial goals while also the ethical responsibility is these organizations, whether it is a commercial organization or a hospital system, they need to better explain to patients and family people what they do with that information. They throw a bunch of papers at you. Does anybody read those papers? Like, if I don't sign it, you're not going to treat me. So yeah, I'm going to sign it. But, especially in this area of genetics, to make sure that the patient understands what you're going to do with that. And so they are okay with it, right? And give them an alternative. If they don't want your data, if I don't want you to have my data, at least give me the opportunity to have my data.
Right.
Because a lot of times these tests are ordered and it was the age-old question in the era of big data is whose data is it? And the hospital system says, well, it's our data. No, it's the patient's data. And what's crazy sometimes is somebody overseas can have access to my financial records, steal my money. It's easier for them to do that than to me to go and get my own healthcare records, right? So I think the opportunity is to better explain, especially as the use cases for genetics and genomics grows, is for these institutions to better help patients understand what they're going to do with that information and possibly give them the opportunity to benefit from it as well.
Yeah. And I think it's one of those ones too, where, we talk about patients being their own advocates, but to me, that's where some of these companies and labs can come in is helping patients be their own advocates by giving them access to data. One of the things that we talked about with somebody in a recent episode on pharmacogenomics was it's challenging sometimes to know the genetic test results or how it plays with like the different types of medications you're getting from all other folks because the healthcare system is pretty siloed. And so by getting at least the patient all this information, they can have it at their fingertips. But it's still, like you said, even a challenge for a patient whose own data it is to be able to access that. One of the things that you do on the Genetics for Healthcare podcast is talking about precision medicine and looking at new technology. So I know you did an episode recently about wearables, which was really quite interesting. I hadn't necessarily thought about the wearables and some of those terms. What are some of the advancements that you've seen or interviewed people about that give you hope that we're improving precision medicine? And then I would say on the other side, and then what are some hurdles that still potentially stand in the way from helping improve precision medicine?
Yeah. So, I mean, it's really all about patient access. And we have innovations that have improved access to precision medicine, improved the field of what we consider precision medicine. But again, like the data shows, patients aren't getting it. Patients aren't getting access to it. Man, there's a lot of innovations. So just think about this. So I was at the recent ASCO meeting earlier this year, the Association of American Society of Clinical Oncology, rather, and they are recognizing that they need to leverage tools, right? Because the growth of genetic and genomic information, these tests, the clinical utility that we're demonstrating through clinical trials is outpacing the clinician's ability to learn about it, integrate it into their practice, and offer it to patients. And so when we think about AI, I mean, just about every interview with an expert that I've done, the topic of AI comes up in some way. And so ASCO has partnered with Google Gemini, and they have it's ASCO Guidelines Assistant. And it's essentially a chat bot. Holy cow. So this is a positive thing, right? So just imagine a doctor who, patient comes in and says, hey, what about this CDH1, variant that I might have? And the doctor's not familiar with it. Well, he can go to his chatbot on his laptop and find out about that information. So things like that certainly make it accessible. It brings information directly into the clinic, and it's backed by ASCO, something that they can trust. There are clinical decision support tools. Because here's the thing. I talked to Dr. Ronan Kelly recently, who is the chief of oncology for the Baylor Scott and White Health System in Texas. And he mentioned that as advanced as medicine is, it still is a system that operates on fax machines. Right. So let me take a minute. Okay. So listen, we need clinical decision support tools because a patient will go see you as a genetic counselor referred to by another treating clinician. You order a report for them. You explain the report to them. But how does that information get in that patient's MyChart so that other clinicians, no matter where they go, can know that that's done? They see that data point and they can make decisions based on that data point. So a lot of times that information, a test that's ordered, doesn't even get back into the patient's chart so it can be dynamic. And even if it does, it's scanned in. So it's like a picture PDF. And so can the MyChart actually pick up that it's there and what it says and what it means? So, I mean, that's another thing is using technology to make this information more accessible and fluent across, that patient's, healthcare journey. And then we have things like liquid biopsy, right? The ability, and I just talked about how version 1 of these genomic tests required fresh tissue. So you literally had to be there in surgery while a tumor was being resected to be able to get this information. But now we can get this information from, a blood draw, saliva, urine in some cases. So there's lots of innovations that are improving the field of precision medicine and making it more accessible. But, the downside are that there's still massive hurdles, right? The growth of companies in the space in some cases creates more noise for clinicians who want to order this. And, they just look at it, it's all the same. And there are certainly nuances in these different tests and these different products. I think you mentioned there's like a whole lot, thousands of these tests out there. Physicians don't have the bandwidth to keep up with this information. And I think I posted a recent Medscape article that talked about the growth of medical knowledge and how it's being affected by genetics and genomics in 2000 and I believe it was 2010. Medical knowledge doubled every 3.5 years. But in 2020, this article reported that medical knowledge doubles every 73 days, right? So the lack of, workflow solutions, the lack of point of care tools to provide clinicians with the latest, the most up-to-date information to know while that patient's in front of them, what might be the most appropriate to help, treat them in terms of genetic or genomic testing. That's still a tremendous hurdle. But I think the biggest hurdle, Kate, is reimbursement, the recognition that these tests are appropriate, that they need to be done, and the same limitation that clinicians have with understanding the utility of this information and having it at their fingertips when they need it, when the patient's right in front of them, so they can make a decision to order that, counsel the patient, and then order. The payers are on the other side with the same problems. They don't have a Kate Wilson on their team. They don't have a clinician on their team that says, yes, you should pay for this. And so in some cases, there are health plans that will deny testing. They will deny access even when it's guidelines. Even when it is endorsed by major medical societies, they don't have that information on their side. And so they use prior auth as a hammer to deter people, from, increasing the cost of care. And so if they can create, and I'm not saying that they do it intentionally at all, but it's just a control mechanism to check some balances to make sure that the patient, gets the things that they need, but it has become a hurdle in the process by not having, tools that can streamline access to this very vital information that could save lives.
One thing that you mentioned is thinking about, yes, there's a lot of tests on the market. I think the other thing I've seen with payers is, and I would say, especially having worked in solid tumor, is this investigational, experimental type of thing when it comes to like biomarker testing, which I get when like something's new, maybe it's not, routine care. But especially in the terms of like comprehensive genomic profiling, we're testing a tumor, we're looking at biomarkers, there's designated treatments for these biomarkers. That's how they work. Is there anything that you think these companies or even like physicians or even patients can do to try to advocate for better insurance coverage on some of these tests?
Yes, and yes. The payers are in a tough position, right? The things we mentioned, the doubling of medical information, right? So the explosion of data is outpacing the clinician's ability to incorporate it. Well, think about what that's doing on the payer side when you're talking to, a claims counselor. And this patient's that person's reading from a script. You say this, I say this. Like they have no attachment to what's going on the other end of the phone, it seems at times. So when we're talking about advocacy, one powerful conversation I had was with a patient advocate by the name of Ashley Dedman. You may be familiar with her work, but she made a decision to do a preemptive, prophylactic mastectomy because she carried a BRCA2 mutation. And in the course of that, she started her journey, and something was done where she was with a certain surgeon at a certain center, and, jobs change, insurance plans change, what have you. And with this new plan, they were recommending that she start all over again, but she was really in the middle of that procedure. And so that insurance plan forced her to go to two other, surgical surgeons that were in their network to say that she was already under the care of someone else and in the middle of this procedure, so they wouldn't, pay for it. So she had to become an expert on her condition for her health plan to be able to pay for the medical care that she needed and that she was on the path to do. So, the ways to advocate for yourself is to know that sometimes your doctors don't know. They're not proficient in precision medicine. And I'm a Gen Xer, right? I come from my mother was a baby boomer, and my parents, my grandparents, they kind of defaulted to the doctor was the smartest person that they would ever know. And so if the doctor said they needed it, they needed it. If the doctor said they didn't need it or didn't say anything at all, it must not be important, right? I think that's changing because our access to information and knowledge, again, that explosion, that doubling of medical information, it's important for us to be equipped. And you as a patient or you as a support giver of someone affected by a condition can be an expert as much as you can in your condition in short order. So don't forget that many doctors may not be aware of this. So it's important to advocate for yourself. And when you go in, the necessity to advocate is so important. You spend 15 minutes, maybe, with your clinician. And in that 15 minutes, over all the things that they need to talk to you about and decisions that need to be made, they may not have the time nor the ability to go deep into a conversation with that patient about genetics and genomics. And so in that instance, the patient will need to make that known that this is important, and I want or need answers for that. And, most doctors all want to do the best for their patients. And so I believe that if there's no time for that, or if it requires a longer conversation, the doctor will say, hey, put these notes into the my chart, or just send me an email and then we'll follow up with you. But all that's important because you need the doctor to be an advocate for you if you need these additional tests and additional therapies for your healthcare provider. So it's important to understand why you need to advocate for yourself, how you need to advocate for yourself, because there are additional therapies. There are additional answers. There might be additional clinical trials or services or a referral that they can do for you that they may not know about because this conversation wasn't introduced, right? So again, the treatment is out there. They are emerging. And I think genetics and genomics need to become a routine part of the conversation with your annual physicals, the conversations with your family. And certainly when talking to your healthcare providers, you want to be armed with policy, you want to be armed with data, and there's places that patients can go and get that, not the least of which is All Access DNA and the Genetics for Healthcare podcast.
Perfect. And I couldn't agree more that it should become a part of just your routine annual checkup. But I appreciate that insight too into advocating for yourself as a patient. Rome, it's been great to talk to you. I want to make sure that other folks can find you. So can you tell them, I guess, virtually where they can locate you?
Absolutely. Go to geneticsforhealthcare.com. From there, you can follow us on any of our social media platforms. We are on every social media platform. So, you might be listening to this podcast on Spotify or somewhere else. Well, we're on Spotify, we're on Apple Podcasts, but I always send people to the website. While you're there, please opt in and subscribe, and you can go to any of our platforms where our podcasts and clips, reels can be seen, listened to, and engaged with.
Perfect. Well, thank you again so much for taking the time and for being on the show today.
It is an honor. Thank you so much for the invitation, Kate.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all episodes of the show. This link is also in the show notes for easy access. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Check out our Patreon at patreon.com/allaccessdna and consider donating to get bonus content, submit questions for our guests, and connect with other genetic curious individuals. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. Please rate and review the podcast on Apple, Spotify, or wherever you listen. This helps other people like you discover the show. All Access DNA is hosted, produced, and edited by Kate Wilson. The logo design is by Designs by NKJ. Thanks for listening, and join us next time.